I'm going to show you how to use X-ray to target a stone. We're going to use the model of a real stone inside some sponge. We've got a real X-ray machine, and as in real life we would set up with the image in front of us quite clearly, and we would have our C-arm with the axis of the C-arm as close as possible to the line of puncture. The first thing I want to do is orientate myself. So I've got the radiographers to take a flash, and you can see the stone in the middle of the view there. I place my needle over my proposed line of puncture, take a flash, and you can see that that is now coming in from the right side instead of coming in from where I stand. Let's make life easier and move that image around so that I'm coming in from the right direction. So now I'm oriented, left is left and right is right. I'm going to start again. We'll place our needle roughly over the line of the stone, and then I make a guess of how deep I'm going to go. So I advance my needle some way towards the target, and as I approach the target, before I puncture too deeply, I want to know whether my depth is right. I'm absolutely right in that AP plane. What about depth? So I'm going to move my C-arm, in this case, over to the right side. So imagine you're looking from that right side. What we see on the image there, if you look, let's have a flash, is that that needle has moved to the left. Now, if that was my target, and this was my needle, if I look from above, I'm going to see them in line. I can't tell if I'm deep or superficial or on target. When I move to the side, if you then see the needle has moved to the left, it means that in fact you are superficial. So I'm going to go in a bit deeper, back to the AP direction. I'll just go in a little bit deeper this time, advancing my needle, and before I've got completely onto the stone, let's repeat, move the C-arm over, and this time you can see that that needle is in fact, I'm pretty much on line to hit. If anything, I would think I might miss it ever so slightly to the right, which is deep. Let's come back. So we'll go ever so slightly superficial as I advance forwards. So if I move my C-arm over now, pause, 2, 1. So here we are looking at the stone, and if I move over laterally, I'm still on target. If I move it the other way, just to corroborate, I'm on target. If anything, looking from this side, I'm going to miss ever so slightly to the left, and from this side that would mean deep. Let's just go over the other way. From this side, you'd hardly think that looks exactly on target. What I'll do, just advance it, and I can feel myself hit the stone. I'm on the target. So that's the principle of using the X-ray from above and then going laterally, rotating sideways to get the depth. You can tilt the C-arm in the other dimension, and I'll just show you what happens there. So let's purposefully get our probe in the wrong direction. If I look from the side, that's way too superficial. Agreed? Back to vertical. Now let's try and move the C-arm over. We'll see what difference that makes. You see the difference, but the distance between the stone and the skewer? Now, my skewer seems to have moved forwards. That means I'm superficial. So if I re-tap a little bit deeper, not changing left to right, but only changing the difference in the line of attack. Move it over to the left. Move my C-arm over, ever so slightly superficial. Move it over towards this way. And it's moving forwards just a tiny bit. Back to vertical again. So we go a little bit deeper, and then we'll be hitting. And there we are, we're on it. What I'm going to show you now is that there are times when you set your C-arm up in what you think is the line of attack. You're making your puncture near the tip of the 12th rib, but let's say you've got a stone right up in the upper pole. You're going to be coming in at an angle like this. So let me drive my needle in the rough direction of the stone. So it's looking kind of promising. And I moved my C-arm over in the usual way. And it's moved backwards and it's moved to the left. Basically, you have two things happening and it can get very confusing. What you will have to do is to bring the C-arm round into the plane of your needle, and it becomes much more straightforward again. So we'll demonstrate that. I'm just going to pause here. If you look at the C-arm, I've now moved it so it's much more in the line of my needle. And now, when I move my C-arm over to the side, it's a much more straightforward difference. It's simply moved to the side. It's not a complex maneuver. So what I'm going to do is make that adjustment. And now we'll move to the side. Ever so slightly superficial still, but not much. Back.
And you're going deeper now?
And I'm going a little bit deeper. Puncture. And you could see the stone move when I hit it. Very close to being on target. But life becomes so much easier now. Very slightly superficial, agreed?
Yes.
So we come back and we can make those differences. Go a tiny bit more deep. We're pretty much on target, guys. And then what I often do is do the final part of the puncture with continuous imaging. And I fit the stone. Thank you very much. Charlotte, this is the patient.
Yep.
In the middle of this virtual patient of a sponge is a stone buried in the middle of it. We've got a real X-ray.
Yeah.
when we position the patient, we have them lying with their, let's say this is the right kidney, their right side slightly raised, and we're coming in roundabouts the 12th rib. And we would aim to have the C-arm with the axis of the C-arm, meaning this, in the line roughly of our puncture, as close as we can get it. And we're going to put we're going to have the viewing box where we can easily see it. The first thing you're going to do, because you're going to do this, and can we just ask how many punctures into the kidney have you done in your life?
I haven't.
0.
0.
So place the needle over where you think the stone may be. Just place the needle over. Keep your hands out the way, and we'll take a flash in a bit, just a little bit further. Flash there.
We've got a flash pen in
Yeah,
it.
you can do it. So what you'll see is that you're roughly on line, but let's rotate the image so that left is left and right is right. So a helpful radiographer comes along and has that needle coming in from the 6 o'clock position. Now plunge that needle from the side, there's the tip of the 12th rib, plunge it in and purposefully get it wrong, so purposefully go a bit superficial and keep going, shove it in a bit. I'll keep that steady, not easy.
There we go.
Right, and we'll have a flash, and you'll see that you're short, number 1, so we'll advance it a bit more. I'd like you to be short, not too far, stop. And you've moved, just come back and get a little bit more accurately onto the stone. So let's watch Charlotte. So try and aim so you get it exactly right on the AP view. Make an adjustment, have a flash. Good. Okay. Now what I'm going to do is to move the C-arm over so it's coming from the right. Have a flash. And you have moved way to the left. So that means if you're looking from that, if you imagine you're looking from here, and you see the needle there and the target there, it means you are superficial. So you don't make any correction in the AP angle, but you come back quite a lot. And we're then going to go quite a lot deeper.
Okay, so if I come down, and then can I re-angle, or do I need to?
You have to re-angle, so come back enough so you can re-angle. And then we'll just advance. You're going deeper. When you said superficially, you went deeper. So we're going to move the expirator over, flash. Still a little bit, but much better. So we're coming back to vertical. Come back enough so you can re-angle and go a little bit deeper. And then keep going on target. Keep advancing. Now let's just see, before you go too far, over we come, flash. So you are going to miss ever so slightly superficially. Now you don't have to come back so much. Just tilt and see if you can go, just keep trying to go a bit deeper. Flash again. Let's have a look. Over we come. Flash. Right, you're up exactly on target. Now, what you can do is to actually screen as you advance. Keep your hands out of the way, but just as you advance, screen.
So is that pressing and holding?
Yep, press and hold. And you're on it.